In addition, a double-blind, randomized, multi-center, and placebo-controlled phase 3 clinical trial was already done in Cuba with good results in terms of safety and efficacy in 149 treated patients. It is worth noting that in the overall analysis, there was a significant difference among the group of 75 and the group of placebo in this case. So here you can see some of the graphic evidence of this particular patient we were dealing with diabetic foot ulcers before, during treatment, and upon treatment in the follow-up period. As observed, a complete closure of the ulcer is obtained in all the cases, particularly in some patients who had suffered previous minor amputation, that as you can see, and were diagnosed in more than 90% to undergo a second amputation. Therefore, we rescue them from amputation, as you can see in all these cases. And now, at the present, so we have developed a formulation, and this is one example of the number of presentations we have of this product in a lyophilized form, either 25 or 75 micrograms per dose. Also, we would like to show you two other cases among 20 Venezuelan diabetic patients treated in Cuba in 2007. These were the most severe lesion of the total Venezuelan patient treated. As you can see, in a period of around 2 months, this particular patient could walk upon treatment with Heveprop P using 13 doses of the product. And for instance, this was the most severe lesion. For instance, this is a calcaneus. This is a consolidated gangrene already. Believe me, in any place of the world, this foot is already amputated. So we managed to treat this foot, and you can see upon 1 year of follow-up, this patient saved his leg already. At the CIGB, we have developed a product and a unique method of treatment that can be given to the diabetic population suffering of these complex wounds. This treatment has the following advantages. So there is a number of advantages we have already established for this particular product according to the clinical results we have obtained in Cuba. Some of them are mentioned here: the acceleration of the healing process of deep and complex ulcer, particular lesion bigger than 5 square centimeters. So we have been dealing between 1 to near 80 square centimeter ulcers. There is no product available in the market for treating ulcers like this. Reducing the number of debridement and surgical intervention, reducing the number of local recurrence, which is a key issue, because it is stated that around 50% of the population that suffer one amputation then can suffer a second amputation in a period of 2 to 5 years time. Can enhance the healing of chronic wounds following repeated local infiltration. And also, the adverse events found with this product has been very low and very rare. And also, we have demonstrated reduction of cost by hospital stay, the concomitant treatment, and surgical intervention, and so on. At the moment, where we are, so we have already a sanitary register in Cuba since 2006. It's also included already within the National List of Medicines in Cuba. We have a strong worldwide patent already granted in 13 territories for instance, included already in US and Europe at the present, that is claiming for a pharmaceutical composition of epidermal growth factor in an injectable formulation, plus a unique method of trimming, which is a local infiltration, trying to get the most deeper zones of the ulcer to stimulate the healing process and to avoid the proteolytic activity that is part of the environment of that sort of lesion or wound. Is indicated for the trimming of the end stages of the diabetic foot ulcer, which remains an unmet medical need. And of course, also we have already commercial agreement in different territories, as you can see. Also, concerning the current status, so this is a summary of all clinical trials already done in Cuba, and the product is in national extension, so at the present is in all angiology units of the country, and we are working very hard with the Ministry of Health to put this at the primary level in all polyclinics of the country. Just for comparison, with the existing therapies in the market with Heberprop P, for instance, one growth factor already known, that is the topical platelet-derived growth factor, which is the PDGF, has been approved by FDA for the treatment of diabetic foot ulcer. Regranets or Vegaplermin approval is solely restricted to neuropathic foot ulcer. In our experience, according to the clinical trials already conducted in Cuba, Heberprop P offers an attractive alternative for end-stage diabetic foot ulcer patients, either neuropathic or ischemic, where the amputation is the only available choice. So we have deal with ulcers bigger than 10 square centimeters, 20, 50 square centimeters. Different news appear in the web concerning Heberprop P upon the clinical results and upon the international launching. We think that while most research is needed, we believe it could be an important first step toward creating an attractive alternative for diabetic foot amputation prevention, which remains an unmet medical need. And also, finally, we think that this is an example of what is called translating clinical research to business. But we think we have done more. We have moved all the way through from the lab bench to the patient bed in this particular case. And finally, I would like to get the opportunity to tell to all of you that we are open to collaborate and to do partnership with the Qatar counterpart and with others, with this and other products we have in the portfolio already ongoing, which are in different stages of development. Thank you.